And now that we've gotten to know Brad Williams a little bit better, I talked to him a little bit more on a personal note of what it's like to deal with the individual patients at SCBN. And he told me about his favorite customer, and he also is going to tell you how you can get the help you need right now. So tell me personally, Brad, you've worked with tens of thousands of patients, probably a lot of them personally. Do you have a favorite?
Yes, as a matter of fact, I do. Barbara, down in San Antonio, Texas. She's been with us over 5 years since the time we started. She was on 17 medications when she started at a cost of almost $2,000 a month for just out-of-pocket expenses that we were able to get her for a fraction of that. And of course, remember, she is living literally on a third of that in terms of income, literally $500 or $600 a month. At this point now, even after 5 years, she's now on a larger number of medications. She's now on 37 plus medications with us that we assist her with getting at a cost of, if it was out of pocket, if she actually had to buy these drugs at the pharmacy, almost $5,000. And for someone on so many meds, it's a full-time job, literally taking 37 types of medications a day. But even though she's on this many medications, she still calls in, and you know she's still upbeat and chipper, telling us how much she loves us, asking me, literally, is everyone else in the office okay, wondering what's going on with their families and how things are going. She's the most wonderful patient that we have, in my opinion.
So it must be a real satisfaction just to work with her and to know, 37 medications, I've never even heard of that many. Is she alive today because of those medications?
Absolutely, and you're correct. That's a ton of medications. It's an incredible amount. It's difficult just to try to take that many medications. It's a lot. And yes, it is an incredible relief and satisfaction when she calls in and just says hi. And we talk about her case and her medications, and we just get a chance to catch up. She's a wonderful person.
Well, you've been taking care of her 5 years. It must be good. Let me ask you one more question. There's going to be a lot of people watching this interview. A lot of people who are suffering from multiple diseases, people with Alzheimer's disease, families of people with Alzheimer's disease, people with cardiac conditions, people with diabetes, women fighting breast cancer. The list can go on and on and on. Hundreds of diseases, taking thousands of different medications that you guys cover. What do you want the American public to know?
I want America to know that if you're suffering because you can't afford your medications, you don't have insurance, and the government won't help you. If you have to choose between buying basic medications and buying groceries or other basic necessities, if you're one of the millions of Americans out there that needs help, help is available. Patient assistance programs exist to help people just like you. If you feel you can navigate these programs on your own, please go to needymeds.com or pparx.org. They can assist you if you can handle this on your own. But if you need an advocate and you need assistance, that's why we're here.
So how do they get in touch with you, Brian?
Well, you can get in touch with us two ways, two very simple and easy ways. You can call us at 888-331-1002, or you can reach us at www.scbn.org at any time, and we'll get back in touch with you between 24 business hours to take care of you.
Well, thank you. I think it's been a great interview, and thank you for taking the time today, and I wish you luck.
Thank you much. I appreciate the time.
All right.